Welcome to You Can Smile Again with Dr. Randy Staples. Today we're going to be discussing mini dental implants. Welcome to the show, Dr. Staples.
Thanks for having me.
Absolutely. Really excited to hear and to learn more about mini dental implants. There's so much popularity that seems to be growing. Can you talk a little bit about that?
Yeah, we have a really informed public today with the advent of the internet, and there's so many people that are more aware of their smile. They're being told that on television, smile's important. So they're doing research, and they're trying to find out ways that they can make themselves look better, improve their smile.
You had mentioned you have placed traditional implants before. So what brought you to mini dental implants?
Mini dental implants. Like I said, I have placed traditional implants, and I had for many, many years. I've just placed the final restorations on top of the implants that the specialist would send me. But I had a friend call me, and one day, and back in November of 2008, and asked me to borrow a such and such mini implant, and he knew that I'm kind of a technology nut, and that I tried to have all the latest in my practice, and I said, "What are you talking about?" And he explained over the phone, so I said, well, just hold on a second, and I made a quick trip to his office, and he showed me what he was talking about, and I asked him where he got it, and I came back to my office and called a friend who now is a good friend, Todd Shatkin in Buffalo, New York, and talked to him about half an hour about mini implants, and he actually sent me some DVDs and sent me some implants, and I started placing mini implants, and then about 6 months later, I went to his office and did a residency with him and trained with him, and have made that an integral part of my practice now.
Well, tell me how, as a possible patient, I want to come in and look at having a tooth replaced or a whole filled that's there in my mouth.
Right.
How does that consult look, and how much is going to see you for that initial consult going to cost?
Actually, in our practice, we offer that as a free consultation. I have very adequate staff. Donna and Celeste are the one. When people call in, obviously I'm back with patients, and when they call in and voice their initial interest, Donna or Celeste, the one, can answer some of their questions on the phone. But when it gets down to the point where they really need to see me, they set up an appointment, and I come in and do a quick clinical exam, take a medical history, discuss their medical history, how they got to me, their experiences previously with maybe I'm a second or third person that they're seeing, and just see how they got in my office. And then if we need to take an X-ray, we do. And in relatively short time, I can pretty much determine if they're going to be a candidate for a mini implant.
What is the major benefit to a traditional denture wear with the mini dental implants?
Well, we all know people, or either family or friends or acquaintances that have dentures. Sometimes we get to know that by someone if in our conversations or in public when we actually see those dentures become unlodged. But for a denture wear, that's it's a horrible thought for your denture to come loose while you're out in public. So with the mini implant, we offer a way to stabilize that denture and get away from the standby that they use is that goop, that dental adhesive, I guess the technical name, where they have to fill that denture full of adhesive to glue it in place so it won't move around. So the mini implant offers a stabilizing factor and eliminates the need for that goop.
It sounds like you can attain even a better health with the mini dental implants because it allows you so much more.
People who have ill-fitting dentures, dentures that don't fit very well, that rub, they hurt, they don't do very well if they're in their pocket or in their purse. They have to be in their mouth, actually be functioning, and they're afraid to eat certain kind of foods when they're out, afraid that it will cause their denture to dislodge. They just can't chew it. So a lot of those folks are restricted in what they eat. They don't eat salads. They don't eat nuts, fresh fruits and vegetables. Very rarely chew meat, a big piece of meat. So it can definitely affect their health if the ability to keep those dentures in their mouth.
How close to natural teeth do they actually look?
Well, you remember growing up when we would mess up and we could do a do-over. You know? Well, for whatever reason, if someone's lost a tooth, whether it be from just neglect or maybe an accident or whatever, they're faced with replacing that tooth. And the way we used to do it is we do a bridge. If we have one missing tooth, we would actually go in and cut off that enamel of the adjacent teeth, perfectly good enamel, and fabricate a bridge that would be cemented in place. But to replace that one tooth, we've actually destroyed the enamel on two other perfectly good teeth. Or you wear a partial denture, or like a flipper, we'd sometimes call it, where it would just be something that fit in their mouth and attached to their other teeth with wires, and that replaced that one tooth. Problem with that is when you don't have that tooth in your mouth, that partial in your mouth, then you have the space there. So for something permanent, you're looking at a bridge or an implant. And that's where I've just been really excited about the advent of the mini implants. Actually, I should say too that and people look at in the literature, we call them mini implants. They're actually termed SDIs, small diameter implants. And when they look on the internet or looking for information, they may see that term SDI. That's what that means, small diameter implants, because our implants are smaller than a conventional traditional implant.
That brings me to my next question, which is, tell me about who would be a candidate. Is there an age limit? Tell me more about that.
In my practice, I placed an implant on a 15-year-old who actually had congenitally missing lateral incisors. And just last week, I placed 4 implants on a 95-year-old lady who she had a partial. And she's in assisted living, and in one of their card games, in her discussion, her partial came loose, and she didn't want that to happen anymore. So she came to me and said, Dr. Stabler, I don't want this to happen again. I want something that'll stay in my mouth. So 15 to 95, in my practice.
And I believe you have pictures from the 15-year-old?
Yes, I do. This is a very interesting case. This young fella came in, and he was born without these lateral incisors, the 2 teeth beside the centrals. And because of that root not being present, the bone never really formed around these areas. So after he got through his braces, and his bite looks really nice, he wanted to replace these 2 teeth. He was faced with wearing some type of an appliance that had 2 false teeth stuck on it, like a removable retainer, to wear for until he reached 18, 19, or 20. Most people don't really like to do a conventional implant until you're 19 or 20. And he did not want to do that. He came to me, saw his mom actually saw some of our advertisement and came in for an opinion, and he actually had enough bone for the mini. So we one morning we got him in and placed 2 mini implants, and then that afternoon he came back in, and my son's actually as a lab technician, and he made these 2 crowns here, and we placed that afternoon.
That really is a do-over.
It's a do-over.
Yeah,
for him.
And being a 15-year-old, moving forward, having your whole life in front of you, that's got to be so rewarding for him.
He had quite a big smile that day when he left the office.
Bet he did.
Yeah.
And in looking at time, I know both traditional and minis, they're both very good solutions. Tell me the time differences between getting a traditional set to that completion point and the mini dental set.
Well, things are changing in the conventional and traditional implant mode too, but when I did them years ago, 15 years ago, usually we would go through a procedure of we'd place the root form it was a surgery involved. We had to cut the gums open and drill a hole in the bone and place that root form, and then we closed it up and waited 6 months for that to heal and for the bone to graft to that implant. And then we got them back and did another surgery and placed the little abutment, we call it abutment, that part that sticks out of the gum, down into that root form, and then we could take an impression to make a crown. if they had enough bone to begin with. If they didn't, then I or a colleague would do a bone graft, which added another 4 to 6 months to the procedure, and to make sure they had adequate bone to place that implant. So with the conventional implant that I placed, usually 6 to 12 months interval from start to completion before you could place that final restoration. With a mini implant, when there's less bone there, and you can go in and actually place the mini implant like I showed you in one morning, and then very quite possibly place that permanent restoration that afternoon. The mini implants actually are screws, like a long screw, and they're termed a self-tapping screw, which means as they slowly are placed to place, they're strong enough after you reach their length to what we call load or place a permanent crown on that day. A crown that can be cemented and is there, it's permanent.
And there are probably different problems that people have that the minis do solve. Mm-hmm. Tell me about that.
Well, it's like we have people that come in with one tooth. Matter of fact, I have some models here. We have people that come in with one tooth missing, like this. This happens to be a front tooth, and this is just a model. We have one tooth missing.
Oh, so that really is very small.
That's a very small, and after we just give a little anesthetic, drill a small hole into the gum, into the bone, and screw that implant into place. And then we take an impression and use our computers to design a crown, and then to mill that crown out. And then later on that day, we have a crown that we actually can cement in place and give that tooth back its smile, or that person back their smile.
That's so quick that amazes
that's
me.
One tooth, Lee. So I mean, also people come in and they have this person happens to have 3 teeth missing, and similar procedure. Mm-hmm. In one appointment, we placed 4 implants, and then we take impressions. With this person, we would use a temporary and send this impression and material off to a lab, and we'd have a bridge fabricated, just like the traditional bridge we talked about moments ago. And then 2 weeks later, 2-3 weeks later, we'd have that patient back, and then that bridge is cemented into place.
So it just snaps in?
No. This snaps in for demonstration.
Gotcha.
So if I turn it over, we don't chase it on the floor. They actually are cemented in place. And
so they are, yes.
They're permanent. They're cemented in place.
So no more goop?
No more goop.
Oh, that's pretty exciting for a lot of people, I'm sure.
Yeah.
So you're talking, even with the model, somebody comes in with one tooth. Is tooth loss a problem?
Tooth loss is a big problem. It's been estimated that we have 40 million people in our country that have dentures or partials, enough missing teeth that require an appliance. And there are also many people walking around, like I spoke about, that have congenitally missing teeth, or for maybe reasons beyond their control, loss of one tooth. Maybe it's an accident. Maybe one of their lower first molar, upper first molar, at a very early age decayed into the point where they had it extracted, and now they're 30 years old, and they've always had that space there, and they did not want to sacrifice the enamel on the other 2 teeth and involve 2 more teeth to replace it. So they just had a space. And as they age, those teeth around that space have a tendency to move around and lean and tilt, which can change their bite. And we've all heard that term TMJ. Mm-hmm. And because of this changing bite, people can have other problems arise. So if we can catch this early enough and stop this snowball effect of loss of more teeth, then the better off the patient is.
So it sounds like they will last a very long time.
The implants?
The implants,
yes. For the research we have, I mean, once we place the implant, this titanium steel implant, and the bone actually adapts and to this implant, there's no reason that they won't last for the rest of their life. They're not like natural teeth. They don't develop periodontal disease. They don't have a socket that they're in. They're actually screwed into the bone. So, like I said, all the research that we have, they have a great longevity, the traditional and conventionals.
And one thing I noticed in our discussion before the show is you talked about how even though that they're harder than than our actual teeth, they will wear with our teeth, won't
Yeah,
they?
the crowns that we place on them. Yeah, the materials that we're using are improving every day. The laboratory materials, and that they actually make materials now that wear very similar to natural teeth.
So you can age with your beautiful smile.
right.
That's
That's correct.
wonderful. Wanted to talk a little bit about the jawbone. A lot of times, I understand that the mini dental implants will help to stabilize that jawbone, and you've mentioned the bone that will regenerate basically around that. Tell me a little bit about it.
Whether it's conventional or mini, once these implants are placed in the jaw, in the bone adapts to that and to that implant and stabilizes, and it secures from more bone loss. The bone that's around these implants stays there. It treats that titanium implant like it was a root, and it has a tendency to stay there, so it stabilizes, so they don't lose any more bone. So, like I said, if we can catch early enough after tooth loss, then we can stabilize that bone and that jaw and prevent future bone loss.
How many would it take to, just for instance, to stabilize even
lower.
just the lower?
I've got an example of that, actually. We brought an example. We usually use 4 on the lower. We place four implants. This is an example of someone who doesn't have a very big ridge, very, very thin. I would say that ridge, would you say, is like maybe 3 millimeters in diameter?
At the most,
and this is a 2 millimeter implant. And this is placed in the jaw in one appointment. And then we have these little O-ring housings that are placed in their existing dentures. Sometimes we have to make them new dentures. If they come in and they've had these dentures for 4 or 5 years, they've already had some recession with the bone, the gums are receded, the bones receded, and we want these dentures to fit down on what they do have snugly. So sometimes we'll have to make them a new denture. But if we can use your old denture, we will. But we place these O-ring housings, and then they just literally snap in place. And so they leave the office with their denture snapped in, and it's fairly hard to snap them in and out.
And you mentioned, we were talking that looks like about a 3 millimeter ridge. That's
no more than 3.5 millimeters wide, that's for sure.
And what would be required even for traditional? You couldn't do that with traditional, could you?
Like I said, they are making new strides with conventionals also, but usually a conventional implant is a minimum of 4 millimeters in diameter, and most people like to have at least a millimeter to millimeter and a half on either side of the implant. So if you have a 4 millimeter implant and you add a millimeter to the front and to the back, that's a 6 millimeter width that you need. And if you use a millimeter and a half, then that's a 7 millimeter width, and that's a pretty large ridge. Plus, you also need the depth or the height of that ridge to be able to hold that root form. And I'd say a minimum of 6-7 millimeters for conventional.
It sounds like patients of the mini dental implants are the happiest. Would that be true?
In my practice, yeah, we have patients that come in and with ill-fitting, with the dentures that won't stay in, and we stabilize their denture, and just 2 hours later they can't believe it when they go in there to take their denture out, and it brings tears to their eyes sometimes, and they get up and run around the office and hug everybody, and they go out and tell everybody how wonderful it is, and they bring their families in to meet us and say hello and refer people to us, to help them.
Can you share some stories with us, how it's changed some people's lives?
I have this one lady that comes to mind that she came to my office about a year ago, and when I go in and sit down, I usually sit down like we're doing here, and I say, "Hi, I'm Randy Staples. What can I do for you?" And this lady immediately she said, "Well, I came here to see if you can help me. I can't wear my teeth," and that's the way she talked to me. And she relayed this story that she lost her teeth when she was 19, I think, and now she's in her 40s. And over the years, she'd had several sets of dentures made, and she couldn't wear them. She said, first of all, she had a really bad gag reflex, so anything in her mouth made her gag. So even when she had to go out for that doctor's appointment or for an emergency or something, she would take this dental adhesive and just fill it full and just glue them in and just make her run as fast as she could and get back home. So she was pretty much a recluse. All of her family functions were done in her home. She didn't venture out, and it was really something just to get to our office. And I looked at the dentures that she just had made within 6 months, and basically they stayed in her mouth until I took my hand away, and I told her she had enough bone. We took an X-ray, and she had enough bone, so she set up an appointment, and we used her denture and stabilized the lower and the upper in less than 2.5 hours. And we were allowed to cut away a lot of that palate. In her case, and like anyone's case on an upper denture, we don't have to extend that palate back all the way. We're allowed to cut away a lot of that and create like a horseshoe, and that was her problem. All this palatal material right here was causing her to gag. So once we cut that away, and she was able to snap that denture in and wear it, and she couldn't believe it. I mean, she left out and went outside to a restaurant that day with her mom, and they had a meal, and she hadn't done that in years. And then she brought her mom in to meet me, and some of her other family, and she's actually referred me some other patients.
Well, so I understand gagging is a problem,
Big problem
for a lot of denture wearers.
A lot of denture wearers, yeah. That palate, we depend on, traditional denture wearers depend on that suction in the upper jaw to help hold that denture in, and to get that suction you have to extend the denture as far as you can, and sometimes that gags people.
I understand you've also helped some patients that are going through treatment for cancer.
Yeah, well, I had a daughter that called me and said that her father was undergoing some chemotherapy treatment in Nashville, and that they were becoming concerned about his health because his inability to eat. The medication was making him sick, and then when he could eat, he couldn't. He complained about chewing because he had sore, sensitive teeth, and she wanted to know if I would talk to the doctor, and I said yeah. So I talked to him, the doctor at Vanderbilt, and he just relayed to me his concerns, and I got an appointment with the gentleman, and he had some grossly decayed teeth that he needed to have extracted, and he had some spaces there too that I knew that I could fill with a mini implant. So I called back the doctor in Vanderbilt while he was sitting in my chair, the patient, and said, listen, if you'll give me about a 10 to 15 day window here where he's not on chemo, maybe some protein shakes or something, and let me get some bad teeth out and get some implants and some crowns in there, we'll get him something he can chew with. So about 3 weeks later, he gave us that window, and he came in one day and we extracted the bad teeth and went ahead and placed the implants and took impressions and had crowns made, and we got him back about a week later and placed those crowns, and that was over a year ago, and he's still doing well.
That's terrific,
Yeah.
and because
it improved his chewing ability.
It's just such a hard thing to go through, and to have and not to be able to eat at the same time.
Sure.
Yeah,
very traumatic.
It is absolutely. Tell me about questions you get from patients or potential patients that come in about the mini dental implants.
Well, first of all, they want to know, am I a candidate? Am I a candidate? There's many times those folks have already been somewhere else and maybe told they weren't a candidate for conventionals. Maybe they didn't have enough bone. Maybe it was a health reason. Maybe it was an age factor. But they want to know if they're a candidate. I do them just like I'm doing with you. I show them the models, and they say that looks like that's going to hurt. So they want to know if it's going to hurt. They want to know how much it's going to cost. How long will it be before they can get their work done? Is it going to be a year or 6 months to a year, like they might have been told previously, or how long it's going to take? Are they going to need a bone graft? Are they going to have a sinus lift? A lot of those questions enter in, but traditionally, they just want to know if they're a candidate.
Well, and you mentioned the bone graft, you've mentioned the sinus lift, because it really, if you don't have those teeth that are supporting really your face,
right,
it dramatically changes, because I know cosmetically that's something that has been important to you, helping people regain that confidence.
Right, their smile.
Yes, yeah, absolutely. Talk to me about someone who is interested in becoming a candidate for the mini dental implants, what are the things that you want to say to someone who's watching today?
Well, I would encourage them to use the media that we have. The internet is there's a lot of things on the internet you don't want to see, but there's some great information on the internet about mini dental implants. I have a website that I recommend to people. It's called minidentalimplants.com. I have a website, randystaplesdds.com. There are other reputable people that have are just dentalimplants.com. I mean, find out, look, do some research, and then call our office. We're there to give advice and the consultation. We're there for second opinions if you need to, but just give us a call and talk to someone in our office. If after talking to someone in our office they think they'd like to have a consultation with me, I'm readily available to talk to them about that. But just find out if they're a candidate.
And of course, we've noticed your slogan, you can afford to smile again.
Yeah.
I want you to address that, but I remember in stories that you've told me actually, how this could actually be 50% or a third less than traditional. So
well, I had a fellow that came to my office. I'll show you. I've got his picture here too. He came in about, it's been a year ago now, but he came into my office and with a story that 7 or 8 years ago he was in school in North Carolina, and he was involved in a work-related accident, and he actually had his 2 front teeth broken off, and he had to have them surgically removed, and had to remove a little piece of bone on the front of each tooth. So he wore a little thing called a flipper. And everybody's seen the hockey players wear those, where they have 2 teeth or 1 or 2 teeth on the front, and they flip that thing in and out, and it just fits in the roof of their mouth. It's very cosmetic. Some people even use them as their partial, but he wore that flipper. He met his wife wearing that flipper. They were married. They're both nurses. They're in Jackson now, and 7 years later, and he wanted to know if he had been to a couple of places to find out how to replace this permanently. Involved in the accident, then he had 1 tooth broken that he had crowned, but another tooth beside it was natural. And this is him, right?
Wow.
This gentleman right here, and he already had 1 tooth crowned. This is a natural tooth, and he wanted to know if he could get this replaced. And he was lacking a little bone here on the buccal, which was going to require a bone graft. So he had seen 2 or 3 different people and got a cost and a time frame. And he actually said he went home to talk to his wife to see if he could afford to smile again. And she said, it's interesting you said that, because I saw a billboard that had that slogan, you can't afford to smile again. And she gave him my telephone number, and he called and came in the next day. And I looked at him and took an x-ray and said, well, you've got plenty of bone there, and we can place the 2 mini implants, and then about 2 weeks later we'll have your permanent crowns. And he was just amazed, and he said, can we do this tomorrow? So we did it, and then he came back in 2 weeks later, and we got him his smile back.
it's amazing that not only is it so wonderful you're able to do that for him, but how real they do look.
I know. It is amazing. We have some really good, my son does a great job, and if we have to send it out, then we have some really fine laboratory techs that do a great job. It looks so natural.
And I wanted to say again, your website is
RandyStaplesDDS.com.
and to call your office, it's 668-6700.
Right, 668-6700.
888 get minis.
888 get minis.
Love that.
That'll do it. That'll do
Yeah,
it.
I am so glad you were able to join us today for the show.
Thanks for having me. I really enjoyed it.
Absolutely, and thank y'all so much for joining us. And again, if you would like to get more information, RandyStaplesDDS.com or 668-6700. Thank you.
Don't delay your smile any longer. Come visit Dr. Staples at the Mini Dental Implant Centers of America, where he'll provide you with the revolutionary benefits of mini implants. This unique approach offers new opportunity for those who have lost a single tooth or all their teeth. This procedure is convenient, minimally invasive, and very affordable. Let Dr. Staples give you a second chance at teeth that look, feel, and function like the teeth you had when you were 16. Call today at 668 6700.